Hello and welcome to the topic Adult Onset Still's Disease in the module Rheumatology. By the end of this topic, you should be able to define Adult Onset Still's Disease, describe the features of Adult Onset Still's Disease, outline the investigations and diagnostic criteria, and finally discuss the principles of management. Let's get started. So what is Still's disease in adults? This is actually a rare inflammatory disease that affects the entire body. Adult onset Still's disease is the adult form of systemic juvenile rheumatoid arthritis. This disorder is named after a British physician who first described systemic juvenile rheumatoid arthritis in the medical literature in the 1800s. A triad of persistent high spiking fevers, joint pain, and a distinctive salmon-colored bumpy rash is characteristic of adult onset Still's disease. It has a bimodal age distribution, which is between 15 to 25 years and 35 to 46 years old. Among the features that you'd expect to see include arthralgia, a salmon pink macular-papular rash, which is most prominent presenting with fever, often seen only when the patient is febrile and easily missed. There would be pyrexia of temperature more than 39 degrees Celsius, especially in the afternoon and evening. Also not to miss, presence of lymphadenopathy, hepatosplenomegaly, and there's often an accompanying sore throat and myalgia. Rarely, there might be aseptic meningitis, cranial nerve palsies, iritis, and peripheral neuropathy. Let's take a quick look at the investigations. Here we see neutrophilic leukocytosis and thrombocytosis, raised serum ferritin, high serum ferritin with low glycosylate fraction are characteristics, and these can be used as disease activity markers. Other inflammatory markers will be raised as well, and this is in keeping with the inflammatory nature of the disease. You'd expect to see raised ESR and C-reactive protein. Interleukin 1, interleukin 6, and interleukin 18, macrophage colony stimulating factor, interferon gamma, and TNF-alpha are all usually elevated. Interestingly, the point that distinguishes this condition from SLE or rheumatoid arthritis is the negative rheumatoid factor and anti-nuclear antibody. Diagnosis is made clinically and should include exclusion of infectious diseases, neoplasms, and other autoimmune diseases. The diagnosis of Still's disease in adults can be challenging. The Yamaguchi criteria is the most widely used criteria and has a sensitivity of 94%. The diagnosis requires 5 criteria with at least 2 major criteria present, as shown in this table. As for treatment, NSAIDs should be used as first line to manage fever, joint pain, and serositis. They are usually trialed for at least a week before steroids are added on. It's simple logic because this is an inflammatory condition and NSAIDs have proven to be useful. The next is steroids. These may control symptoms but have shown limited benefits in improving prognosis. Other immunomodulators can be considered in the event steroids and NSAIDs fail to improve symptoms, and these are methotrexate, interleukin 1 or anti-TNF therapy. As for prognosis, it tends to be better when systemic symptoms predominate. Let's summarize. Adult onset Still's disease or AOSD is a rare inflammatory disease which affects multiple organs in the body. It has a bimodal distribution of age and typically presents with salmon red rash, arthralgia, and fever. Other systems that can get involved include the central nervous system and the eye and liver as well as the spleen. Diagnosis is made clinically, but inflammatory markers are useful to establish diagnosis. The Yamaguchi criteria is used to diagnose Still's disease of adult onset. Treatment is aimed at reducing systemic inflammation. We have come to the end of this topic. Thank you.